So, in continuation with the parasitic infections that have been taught to you currently, we'll continue with the helminthic infections. And in today's class, we'll discuss about the blood and the tissue parasites. And specifically, we'll look into the helminthic infections. Now, you have to remember, like all other microorganisms, most of the parasites have actually evolved along with the human beings. As the human beings evolved from the probable single cell organism to as what we are today, these parasites also have evolved. Furthermore, during the migration of the human beings throughout all the continents, these parasites have carried on with the human beings along with the migration. So, some of the parasites, or I would say most of the parasites, have evolved in a certain way that they have adapted to the conditions of the human body. Thereby, you will find most of the parasites which are capable of infecting the human beings are able to evade the immune mechanism of the human body. Similarly, if we do look at the parasites which infect animals, they have evolved in that way. This is this fact should be remembered because some of the infections, mostly the zoonotic infections, in which some of the parasites infecting the animals will eventually infect the human beings. And those parasites will not be able to evade the immune reaction and thus will lead to a variety of different presentations. Hence, we will look into them sequentially. Now, if we look at the helminths, we can classify the helminths based, first of all, what are helminths? Helminths are parasitic worms which are capable of infecting human beings. Again, depending on the system or the part of the body which they infect, we can classify them either into blood helminths or tissue helminths. When we say blood helminths, we are referring to the blood and the lymphatics. That means lymphatics which will eventually have access to the vascular system. Similarly, again we can classify based on the type of the helminth. As you know, helminths can be classified into either platyhelminths or pneumohelminths. Hence, we can classify them into nematodes, cestodes, or trematodes based on the type of the parasite. Most of the blood helminths which do infect will include the filarial worms and some of the trematodes which include the cystosoma. Other than that, specific organ systems may be infected, like the CNS infections may be caused by various types of cystode and trematodes and even nematodes infections. Some of are common, some are relatively rare. Furthermore, some of the helminths will have the ability to infect the skin, soft tissue, and muscles. Similarly, many helminths, especially the trematodes, are able to infect the hepatobiliary system. We'll look into them one by one. First, let us look at the nematodes, which do infect the tissues in the human body. If we look at the classification of the nematodes which infect the human body, you can find most importantly is what is called as the lymphatic filariasis, followed by disease called Loiasis, Onchocerciasis, Dracunculiasis, Trematodes, and Visceral Larva Migrans. First, let us look into what is filariasis. Now, the word filarial, filariasis is the disease caused by parasitic Filarial. Now, what is Filarial? These are microscopic roundworms which are present in the blood and the tissues of the human body. Those are called as Filarial. So, the disease caused by the Filarial is called as filariasis. This disease has been described in the ancient text and can also be found in the history of a civilization. Most notably, you can find the Greek and the Roman civilization differentiating leprosy from filariasis very early in the text. Now, leaving the history aside, What are the causative organisms causing filariasis? Predominantly, we have three important causes. One is called as the Wuchereria bancrofti, Brugia malai, and Brugia tumor. There are other also causes. I'm not delving into them right now. These are the three most important causes. Now, if we look at the geographical distribution of the disease, as you can see in this world map, the Indian subcontinent, along with most of the Asia, are endemic for filariasis. Now, if we look at the life cycle of the disease causing organism, you can find that there are two hosts. One is the human, and another is the arthropod host, where it is the mosquitoes. What happens actually is the adult male and female worms are present within the human body. Most specifically, are present within the lymphatic system. The male and the female worm copulate and they produce a larva which is also called as microfilariae. This microfilariae is released from the lymphatics into the blood, where the mosquito during the blood sucking meal will take up the microfilariae. The microfilariae will undergo developmental change within the mosquito, and when the same mosquito bites another human being, this larva then infects another human being, where it forms the adult male and female and slowly reside into the lymphatics. So this is the life cycle. Hence, you can see all the organisms will need a vector. In India, the most common organism is Wuchereria bancrofti, and the filariasis disease caused by this is also called as bancroftian filariasis. The vector of this organism is Culex mosquito. As far as the Brugia is concerned, for Malay it's a Mansonia species, and for Brugia tumori is Anopheles and also Mansonia. Now, moving on, coming to the clinical manifestations. First, what you need to understand is initially after the bite of the mosquito, the microfilaria enters into the bloodstream. Sorry, the larva, infecting larva, enters into the bloodstream and it changes into the adult worm which resides in the lymphatic. During this stage, most of the patient will be asymptomatic. Gradually, when the adult worm starts producing microfilaria, it increases in size and because of the immunological reaction within the lymphatics, what happens is there is inflammation within the lymph nodes, which is also called as adenitis, resulting in swelling of the lymph node associated with pain. Now, this is the stage that can be seen over here. Commonly, the local lymph nodes, either the inguinal lymph node or the axillary lymph node may be swollen. This is the stage of adenitis. As the worm persists on, the inflammation gradually increases. Slowly and steadily, the lymphatic vessels will be malfunctioned. The very important function of the lymphatic vessels is to transport the lymph from the peripheral tissues into the bloodstream. When this is altered, the lymph is not recirculated into the bloodstream, hence it gets deposited in the dependent areas leading to what is called as lymphedema. As the worms further progress on, some of the worms will eventually die, and when the organism dies, it leads to even severe immunological reaction with the lymph node, thereby complete cessation of the lymph transport from the limbs into the bloodstream. The lymphedema increases in the peripheral sites like the arms or the legs and also in the groin, especially the scrotum and the vulva, scrotum in males and vulva in the females, which may lead to various manifestations like pedal edema or hydrocele, and this will increase gradually as the failure of the lymphatic vessels occur. Slowly and steadily, as you can see in this picture, the lymph edema will increase, resulting in gross enlargement of the foot, also called as elephantiasis. That means the foot which resembles that of an elephant. So, now you can see the clinical manifestation. At the first stage, it is mostly asymptomatic. At the stage of the microfilaria, where the patient is a carrier, you can have some constitutional symptoms like raised eosinophil levels, headache, malaise, and sometimes associated with fever. Thereafter, we can find in case of acute recurrent filaria, we'll have fever, the stage of lymphadenitis, and thereafter, when the disease goes into the chronic phase, we can find these clinical manifestations. The lymphedema can also be classified based on the degree of the lymphedema into grade 1, 2, 3, and grade 4, where there is noticeable changes in the skin. Most importantly, these changes lead to secondary bacterial infection of the skin, and because there is a problem with the lymph drainage, the infections also do not heal properly. Another phenomenon that does occur, which is also called as occult filariasis. Now, what is occult? Occult means what is not seen. That means this is the stage where the microfilaria is not found in the blood, however, it is present in the body. And because of the reaction of the human body, immunological reaction, which causes called filariasis, where the eosinophil levels will get increased and the patient may have pulmonary symptoms and systemic symptoms. However, during this stage, if we do examine the blood of the patient, we will not be able to find microfilaria. So these are the presentation of filariasis that we can find. Now let us come to the diagnosis. How can we actually diagnose? The most common method of diagnosis of filariasis is take the blood sample of the patient and look for microfilaria, as you can see in this picture. Some of the filarial organisms may have a diurnal or a nocturnal variation depending on the species. But many a times, practically, we will not be able to find microfilaria. Hence, many methods have also been devised, like concentration method, either with a membrane or a net knots concentration method, or sometimes using provocation with the use of a drug called DEC. This can be given so that the worm releases more and more microfilaria in the blood, and after which, if we take the blood sample, we can find the microfilaria. Furthermore, depending on examination of the microfilaria, we can ascertain the species which infects the human being. Now, this algorithm is important. As you can see, when the microfilaria is found in the peripheral blood, first we need to look whether the microfilaria has a sheath or is an unsheath. Now, if it is a sheath microfilaria, then we have to look for the nuclei at the tail. If there is no nuclei and a sheath microfilaria is seen, it is Wuchereria bancrofti. If the nuclei is present and is single, it is Bugia malai. If there are multiple nuclei in the sheath, then it is Loiasis. We'll come to it later. And if it is unsheathed and without, and then we have to look at the nuclei, there is no nuclei and blunt tip we can find in Onchocerca volvulus. We'll come to it also later. So most importantly is what you have to remember is the feature of the Wuchereria bancrofti, that is, you will have a sheath and without any nuclei at the tip. The other methods of diagnosis of microfilaria would include diagnosis with the help of immunological methods, in which we can detect the antibodies that are present against the filarial worms. Alternatively, during the stage of the lymphadenitis, we can use radiological methods like an ultrasonography to demonstrate the worm in the lymph nodes itself. That was all about the diagnosis. As far as the treatment is concerned, the most effective treatment that is being given is use of DEC. With the use of the DEC, it is very effective agent to clear the microfilaria. Hence, under the National Vector-Borne Disease Control Program in India, DEC mass therapy is also given. Obviously, India is endemic for bancrofti and filariasis. Furthermore, the adult worms will also have a particular bacteria called Wuchereria, which is necessary for the survival of the worm inside the body. Hence, doxycycline can also be given to get rid of the adult worm. Please do remember, even with therapy, the adult worms will remain present in the human body. And if the patient does have in the stage of lymphedema, especially grade 1 or grade 2, corrective surgery or the lymphatic surgery can be done to correct the lymphedema. But if the patient has already progressed at the stage of elephantiasis, the therapy obviously remains, that is the care of the skin so that secondary bacterial infection can be prevented. Now coming back to the next type of microfilaria that we can see is called as the Loiasis. Now Loiasis is a nematode infection. Very popularly you can find this picture in which the worm is extruding out of the eye. Now this microfilaria was initially discovered by Mackenzie, and the adult worms, both the male and female, were described by Robertson. Now who is this Robertson? He is Dr. Argyll Robertson. Have you heard about Argyll Robertson, people? He was an ophthalmologist. He was working on physostigmine. You have heard about physostigmine or not? So when he was working in the Caribbean, he found that his maid had swelling in the eyes. Thereafter, he was able to extract the adult worm from the eyes, and he also called those swelling called as the calabash swelling. Now this nematode is spread by bite of this arthropod. This is called as the Chrysops species, or also called as the mango fly. Like mosquitoes, the female form of this fly will need a blood meal for production of eggs, and during the blood meal it will transmit the microfilaria from one person to the other. Now this microfilaria will eventually turn into an adult. However, unlike in filariasis, this worm will now move inside the body and will move from one place to the another. Sometimes we can find swellings like this in the patients. The swelling remains for about a week or two, and then the swelling disappears as the adult worm moves. Many a times it can be seen in the conjunctiva and hence can be extracted. Please remember, the worm that is extracted is the adult worm, not the microfilaria. If we look in the blood, we can find, or if we take the fluid sample from this swelling, we can find the microfilaria of Loiasis, and it looks like this, where it is also sheathed and will have multiple nuclei in the tail. The next, now some cases of Loiasis has been reported in India also. The next important disease is called as Onchocerciasis. This disease predominantly occurs in the tropical belt in Africa. In India, it is not seen. However, nevertheless, what happens is that the simulium fly or the black fly is the vector where it transmits the microfilaria of this Onchocerca. It enters into the human body through generally the exposed parts, that is the arms and the feet, and also occasionally in the face. Thereafter, this microfilaria will roam within the tissues and may lead to various kinds of manifestations, like it may lead to skin manifestations, which may be manifestations as acute papular onchodermatitis in the acute stage. Later on, it may lead to the stage called as the chronic papular onchodermatitis. Other than that, we can find manifestations like skin atrophy, depigmentations in the skin. It may also lead to scrotal manifestations or lymphedemic manifestations like elephantiasis or hydrocele. It can also lead to manifestations like mastitis and epidermalitis, especially in females, both in the breast and the vulva. But most important manifestations of Onchocerca involve involvement of the eyes, where it may lead to punctate keratitis, retinitis, and eventually lead to blindness. Sometimes the worm may also enter into the brainstem and the cerebrum, leading to various kinds of manifestations from epilepsy to meningitis, etc. As you can see in this picture, we can find punctate keratitis and sclerosing keratitis leading to blindness. Now, this simulium or the blackfly is found near the river. Hence, the disease is also very commonly seen in areas along the river. This disease, hence, is also called as river blindness. These are the pictures where you can see gross depigmentation of the skin with lichenification, also called as leopard skin. The next tissue disease is called as Dracunculiasis. Dracunculiasis is also called as the guinea worm because it was first described in Guinea. However, historical tests have also described the disease not only from the Middle East but also from India. Now, this disease is caused by the organism called as the Dracunculiasis medinensis. This disease was very much prevalent much earlier, especially in the last century, but now with the global eradication program, this disease is now almost eradicated. India has been declared as free of this disease for many years, and now only a few African countries have this disease. Now, if we look at the disease, what actually happens over here is the worm is present within the body of the patient, and when the female worm is about to lay the larva, it will irritate the skin in the foot or in the areas which do come in contact with the water. So, people who generally carry water bag in the back, they may have lesions in the back also. But commonly, these lesions are seen in the foot, especially in arid areas where people reach out into the water bodies by going into the water bodies. Those can be seen even in India. Those are also called as the step wells. I think most of you have heard about the step wells in Rajasthan. So people used to walk down the stairs into the water to fetch the water. Now, when the feet comes in contact with the water, the adult worm will give out some of the enzymes of the fluid which are irritant to the body, which will lead to formation of the blister. Thereafter, this blister will rupture and the adult worm will come out from this opening to lay the larva. Larva now goes into the water, that is the normal cycle, and sometimes when people are drinking the same water, it is again ingested and it finds a new host. So this is the life cycle where the larva infects the cyclops. Those are present in the water, and when people acquire this, ingest the cyclops either by drinking or eating fish or amphibians from the same water, will get infected. As far as the treatment is concerned, most of the drugs don't affect the adult worm. The best method of treatment in case of Dracunculiasis is extraction of the female worm through that opening by gentle traction that is given for a period of days. However, eradication has been, at least in India, has been done mostly by facilitating sanitary water and prohibiting the use of step wells. So these are two very important methods which have led to eradication of the disease from India. The next tissue nematode is trichinellosis, caused by Trichinella spiralis. Now, this organism has a normal life cycle which actually circulates either in the wild, also called as the sylvatic cycle, or in the domestic cycle where it circulates by in the pigs. This is the larva and it is ingested by the animal when it is ingesting the meat. The larva enters into the body and from the gut it moves into the muscles where it forms a cyst and the larva remains in that cyst. When another animal eats this infected animal, the muscles of the infected animal, that animal will ingest the larva along with the cyst and the cycle continues. How does the human beings get infected? Human beings get infected when they eat animals like pigs which are infected with this larva. As you can see in this world map, this disease is prevalent almost worldwide. There are many species, like in India, you can see the most common species is Trichinella britovi. Now, coming to the clinical manifestation, after a human being eats the Trichinella infected pig, muscles of the pig, what happens is initially the larva enters into the gut and penetrates the gut, leading to the gastric manifestation like nausea, vomiting, diarrhea, and pain in the abdomen. Thereafter, the larva within 1 to 2 weeks will move into the muscles, which will lead to irritation in the body, leading to fever and chills, and then swelling start to appear in various parts of the body. This may be associated with headache and other constitutional symptoms. Now, as you can see, when this larva gains access into various parts of the body, we can find various manifestations. Like when it gets access into the orbital region, it may lead to proptosis, irritation of the eye. It may lead to many skin manifestation when it is moving underneath the skin. And if it enters into the muscles, what will happen? The same thing that happens in the pig, that is, it will enter into the muscle and form a cyst, leading to swelling of the muscles along with pain. Now, obviously, human meat is not eaten, so this will end in a dead end infection. There is a definitive clinical criteria for diagnosis of trichinosis, which will include the clinical, laboratory, and epidemiological criteria, and the manifestations are also characterized based on acute or chronic presentations. The final part of the nematode infection is called as the visceral larva migrans. Now, when we say visceral larva migrans, that means there is another form which is also called as the cutaneous larva migrans. And what does the word larva migrans means? It is the migratory movement of the larva within the body which will lead to the manifestations. Either when it moves under the skin, it is called as the cutaneous larva migrans, and when it moves within the body, we call it as the visceral larva migrans. Now, visceral larva migrans is caused by two organisms which are also called as the dog or cat roundworm, Toxophora catis and Toxophora canis. So, normally they will have a normal cycle within the cats and dog. However, human beings can get infected, especially if they have access to, or many people will live together with dogs and cats and get exposed to the fecal matter of both cats and dogs. And these cats and dogs, the eggs will come out, and if these eggs are ingested, the human being will get infected. Now, please remember, what happens in the intestinal nematodes is that the eggs, when human beings ingest, they will mature, the larva will mature and form adult worm, and the life cycle will continue on. However, please remember, these are not human roundworms. These are roundworms of the dogs and the cats. Hence, after the eggs are ingested, the eggs will hatch to form larva. However, the larva cannot mature into the adult worm. It results in a dead end infection. So, what the larva will do? It will try to escape the gut of the human body and move into the various tissues. This leads to the manifestations which are called as the visceral larva migrans. Now, what will be the manifestation? As you can see in this picture, the manifestation can be differentiated into the type of the organs that are infected, either the gut or the ocular system or the neurological system. So, obviously, if the larva penetrates the gut and moves in the gastrointestinal system, it will end up presenting with various kinds of gastrointestinal manifestations. And furthermore, this larva will remain within the body, which can be seen by various radiological methods like ultrasonography or MRI scans. Initially, they will produce an inflammatory reaction, and slowly, as the inflammation subsides, they may also get calcified. Now, coming to the ocular manifestation, very commonly you can see the ocular manifestation like it is redness of the conjunctiva or the red eye. It can cause red eye, and sometimes, very rarely, the larvae can also be seen within the eye to the cornea. Neurologically, it can gain access into the brainstem and the cerebrum itself, where it will eventually die off. However, prior to that, it will cause inflammatory changes which may manifest as epilepsy or seizures in the human body. Now, this was all about the visceral larva migrans. Another kind of roundworms of the cats and dogs, like Ancylostoma brasiliensis, these roundworms, now I think intestinal nematodes have been taught, right? So, about human intestinal infection, what happens? They penetrate to the skin of the feet and then it will move through the skin to the lymph node and eventually gain access through the pulmonary route into the gut. Now, again, these are the worms of cats and dogs. So, they don't have the methods to evade the human immune response. When they do enter by puncturing through the skin, especially of the feet of the exposed person, what will happen? It will move through the subcutaneous tissue. However, it will cause a very vigorous reaction because human body will react against it. This will lead to these kind of manifestations, serpentine tract with inflammatory changes. This is called as cutaneous larva migrans. Have you understood? So human infection, human worms, they will also move through the subcutaneous tissue. However, because they have evolved along with the human beings, they will not elicit the immunological reaction. Okay, so this was all about the tissue nematodes. Among the intestinal nematodes, I think you are already acquainted about the various intestinal nematodes like Ascariasis, Enterobiasis, Strongyloides, Trichuris, Anisacariasis. Most of them have will reside within the gastrointestinal tract and life cycle goes on within the GI tract. However, an important intestinal nematode is Strongyloides. Why this is important? Because this nematode can, first of all, it can cause auto-reinfection within the human body itself. That means the adult worm will live or give birth to the larvae within the human body, and these larvae will again infect the same individual, thereby increasing the worm load within the body itself. This can lead to cutaneous manifestations like this, or it may spread all throughout the body, which is also called as strongyloides hyperinfection syndrome, where it may gain access to anywhere in the body from skin to tissues to gastrointestinal organs and even into the lungs. Now, this hyperinfection syndrome is generally seen with people with altered immune system or immune compromised patients like diabetics, HIV infected, and it is also seen in people who have been given systemic steroid drug. Okay, so it is very prudent if you give systemic steroid, please ensure the patient is not infected with any intestinal wounds. If you do give in presence of an active infection, it may flare up like the hyperinfection syndrome. Now coming to the cestodes, now intestinal infection of teniasis have been all been taught to you, but today we will discuss about the important feature, that is the extraintestinal manifestation, which is seen in what is called as Cysticercus. Now, infection with Tinea saginata, what kind of Cysticercus is seen? It is Cysticercus bovis. Infection with Tinea solium, it is seen as Cysticercus cellulosa. Now, Tinea solium is found in pigs. Humans get infected either by gaining access to the eggs or the gravid proglotids, which can be found in the fecal matter. Now, after ingestion of this, it will form larva, which is also called as Cysticercus cellulosae. That is a sac. Cellulose means it's a sac, and it will contain what is this growing scolex. Now, this Cysticercus cellulosae can be found in the muscles of the pig, and human beings may also acquire if they eat improperly cooked meat of the pigs. When I say improperly cooked, what you have to remember is the meat should be heated. Smoking, salting, pickling, other methods of preserving meat is not able to kill the larva within the meat. Hence, human beings can get infected. After getting infected, the cycle goes on in the human body like that in the pig, and this cellulose can be found at various parts of the body within the muscles and also in the subcutaneous tissues. As can be seen, like in these patients, you can find very small swelling throughout the body. These are the cellulose that are present. The radiological examination, you can see there are multiple cellulose which are enhanced in this image. Sometimes these can also be seen in accessible areas like eye or under the eyelids. Again, these can also be seen accidentally, especially in the peritoneal surfaces when the patient is put for surgery. Now, generally what will happen, these cellulose, if they do not rupture, they will only present with manifestation of the local manifestation. When I say local manifestation, it means it is the local swelling of the tissues which will lead to the manifestation. The patient may complain of swelling in the skin or pain in the abdomen if any organ is affected. However, if these sacs get ruptured, it will lead to all the fluid that is present within the sac will come out into the bloodstream or in the local tissue, which will lead to a very vigorous reaction, immunological reaction. Furthermore, sometimes this may gain access into the brainstem and in the cerebrum, which we also called as neurocysticercosis. Common presentation of neurocysticercosis obviously will easily manifest with epilepsy or seizure because of the space occupying lesion. Sometimes these seizures can be accentuated, especially if the worm dies or the fluids of the sac comes out within the brain itself because it is a highly irritant. Now, this is the picture which you can see small swelling within the brainstem. This is the post-mortem finding, and radiologically, these kind of swellings can be seen. So the presentation will vary according to the site where these sacs are present. And as far as the neurocysticercosis is concerned, they are again classified into 4 types depending on the stage of the cellulose, whether it's in the vesicular stage or the colloidal stage or the granular stage or involution stage. Now this staging can be done either with the help of pathological examination, mostly post-mortem, or antenatally can be done with the help of a CT scan or an MRI scan. Treatment again will depend on stage of the disease. And treatment involves use of drugs like albendazole, and also steroids are given to decrease the immunological reaction which leads to the manifestations. The next disease, which is echinococcosis. Echinococcosis is a disease caused by the cestodes called as Echinococcus granulosus. However, there are other echinococcus like Echinococcus multilocularis, Vogeli, and oligotheres. Overall, there are four types of presentation. The first type, or the most common, is called the cystic echinosis, caused by Echinococcus granulosus. The next is also called as the alveolar echinococcus, caused by Echinococcus multilocularis. And the two neotropical forms, either polycystic or unicystic, caused by Echinococcus bogelii and oligothus respectively. Now let us first discuss about cystic echinococcus. Now cystic echinococcus is also known as the dog tapeworm. This is the picture of the dog tapeworm. So normally this cycle goes on within the sheep and the dog. So what does the human beings comes from? Infection. The infection of human being occurs mainly accidental, by accidental ingestion of the eggs of the dog tapeworm. Again, it will be a dead end infection because human beings won't be able to transmit. This will form, enter into the gut, and will enter into the hepatic system, hepatocellular system, and form what is called as hydrated cyst. The larva will form a envelope around the cyst, which is also called as the pericyst. Actually, the pericyst is made up of the human cellular elements depending on the organ that is affected. And within the cyst, you can find these collexes, also called as brood capsules, and hydrated sand. Now, please remember the hydratic fluid is extremely anaphylatoxic. That means it will lead to anaphylaxis. Hence, what will be the manifestation? The manifestation will depend on the organ that is affected. Most common organ that is affected is the liver, followed by lungs and spleen. The manifestation will be space occupying lesions, and very rarely, if the cyst ruptures, it may lead to anaphylaxis. So these are the pictures. As you can see, post-operatively the cyst was removed, and these are the collexes which can be seen. These are the magnified image, and this is the liver which has been sectioned. These are the USG images, and again, treatment will depend on the staging of the disease. The staging is done predominantly based by the ultrasonographic images, where it can be staged from cystic lesion to inactive lesion based on the radiological findings. Like in cystic lesion, there will be no cyst visible. In the C1 phase, there is an active cyst visible. In C2 phase, as you can see, multiple collexes can be seen, and it is also called as the snowflake sign in this one. And over here, you can see the honeycomb appearance. As the cyst matures, you can see radiologically, we can see a different pattern. It is also called as the water lily sign. And finally, then we can find the C4 and C5, where the larvae dies and we can find a homogeneous structure. Treatment of this can be done either by surgical resection of the cyst itself, or we can use what is known as the pair therapy. Now, pair therapy stands for pair therapy stands for percutaneous aspiration, instillation, and re-aspiration. That means, suppose this kind of cyst is present in the liver. Initially, with the needle, we percutaneously enter into the cyst and aspirate the hydrated fluid that is present in the cyst. Then, to kill the infective larva, we instill some cidal agents. Most commonly, 20% normal saline or 95% ethanol or 1% cetrimide can be used. And after a period of exposure, around about 20 minutes, the same material is again re-aspirated. So this will not only get rid of the anaphylatoxic hydratic fluid, but also the infective larva. However, protective measures should be taken because any exposure to the fluid may lead to gross anaphylactic reaction. Alternatively, albendazole can also be given. However, especially in cystic echinococcus, surgical management is the definitive method of management. Now, coming to the next type of manifestation, also called as the alveolar echinococcus, caused by Echinococcus multilocularis. And the most important differentiating features is that in cystic echinococcosis we usually found one cyst, but in alveolar echinococcosis there will be multiple cysts. Hence the name is multilocalized. The most commonly affected organs include the liver. As you can see in this image, there are multiple cystic lesions, and on gross pathology you can see multiple cystic lesions again, like over here. The next organ that can be affected is the lungs, and sometimes other gut, and even the CNS can also be infected. Please remember, in case of the infection with the alveolar echinococcosis, surgical treatment is generally not recommended because the number of cysts are small and multiple in numbers. Hence, the treatment that is given is mainly use of systemic steroid along with albendazole to clear the cyst. Now, two more types of echinococcosis can be seen with the neotropical echinococcosis. Now, coming to the trematodes, now we have covered the nematode infection, the cystode infection. Coming to the trematode infections, we have the diseases like fasciolopsis, clonosiasis, fascioliasis, schistosomiasis, and paragoniosis. First is fasciolopsis. Fasciolopsis is caused by Fasciolopsis busci. This is the largest trematode. This is found in what is called as the water chestnut. Bangla pani fal bole. So, when human beings eat this water chestnut, what actually happens is that they ingest the metacarpal form of the larva that is present within the water chestnut, and upon entering, it will enter into the stomach, and in presence of the gastric acid, it will come out of the stomach, then will penetrate the duodenum, and from retroperitoneum, it will enter into the biliary tract. It remains within the biliary tract. Initially, it may cause inflammatory changes leading to cholangitis, and sometimes when chronic inflammation ensues, it may lead to cholangitis, cholelithiasis, and sometimes even hepatitis. Sometimes it may even block the biliary ducts, leading to enlarged biliary radicals, hepatobiliary radicals. Now, this adult fasciolopsis will give out the eggs which will come out from the biliary tract into the GI, and from GI it will be liberated into from the stool into the environment. From the environment it will be again taken up by the water, and with periodical development the larva will enter into the snail, and from the snail it will mature, come out as free swimming cerci, which will then attach with the plants, the water chestnuts. Now these are commonly seen especially in areas where there is a cultural habit of eating water-based plants, and especially in India, in some of the areas which was earlier poverty-stricken, especially in parts of Bihar, Jharkhand, and West Bengal, people used to eat these water-based plants. Hence, they used to get repeatedly infected. Another type is called Clonochis sinensis. It is again a trematode. Again, this is acquired by eating fishes of carp. Carp means in Bengali it is also called as the puna mach. So these fishes acquire the swimming cerci which is present within the flesh of the fish. If uncooked or raw fish is eaten, human beings get infected, and similarly this larva will again enter into the human body, and from there it will penetrate and enter into all parts of the GI tract, especially the biliary region. The eggs will be liberated from the GI tract, and again it will enter into the water, forming larvae which will mature in the snail, and when these snails are eaten up by the fish, they will from the snails it will mature into the free swimming larva, and then again taken up by the fishes. So this is the natural cycle that goes on. Now, this Clonochis sinensis may infect almost all GI organs, and this is also a very important cause of biliary carcinoma. So, one of the infective organisms we can cause malignancy is Clonochis sinensis. The next is fascioliasis. Do not get confused with fasciolopsis. Fascioliasis is caused by Fasciola hepatica. So this is also called as the flatworm, and it invades the liver. As you can see, dilated liver radicals within the worms. This is the adult worm, and the life cycle is almost similar, where the human gets infected by eating water-based plants or called as watercress. জলকুম্ভি বলে যেগুলোকে বাংলা. So these watercress, when human beings eat, the free swimming metacarpia get attached to the watercress and then enter into the human body, and from there it will ensheath in the stomach and again then migrate through the duodenum into the hepatobiliary system, where it will mature to form adult, lay the eggs. The eggs will again come out and will develop within the snails, and the cycle continues on. Now within the hepatobiliary tract, it may cause cholangitis, cholelithiasis, hepatitis, etc. Now please remember, when we are talking about this trematode infecting the GI and the hepatobiliary, it also interferes into the normal nutrient absorption of the human body and may lead to malnourishment. Like in case of Chronic sinensis, the inflammation may lead to gross enlargement of both liver and spleen, and sometimes there may be fibrosis of the liver and hepatic failure also may ensue. Next is schistosomiasis. Now, unlike the previous trematodes, schistosomiasis actually infect the blood system, that is the vascular system. There are three important schistosomiasis that you remember: is the schistosoma hematobium, mansoni, and japanicum. Now coming to the life cycle, again the eggs will mature and develop in three types of snail and then come into the fresh water. This free living metacarpia will enter into the human body through the skin. Initially it will penetrate the skin and cause local irritation and reaction, which is also called as swimmer's itch. From there it will move into the lymphatic system, and from lymphatic system it will enter into the mesenteric vessels. Mansoni and japonicum will enter into the mesenterical vessels, whereas hematobium will enter into the vesicular, that is the vessels of the urinary bladder. The adult worm lives there and will lay the eggs through these vessels. Hence, the eggs of Mansoni and japonicum will be released within the gut. But in case of hematobium, it will be released within the urinary bladder. Initially, we can find acute illness, also called as acute schistosomiasis, also called as Katayama fever. This is because of the migration of the larva within the human body and initial infection. Later on, chronic granulatory inflammation can be seen both in the large intestine, rectum in case of Mansoni and japonicum, and in case of urinary bladder will be in case of schistosoma hematobium. Every time the female lays the eggs, there will be small bleeding both in the bladder and in the gut. This may lead to manifestations like, if the infection is in the gut, lead to constipation followed by diarrhea and passing out of blood. In case of urinary bladder, it may lead to irritation of the urinary bladder and slowly calcification and granulation of the bladder and inflammation. So you can see there is gross swelling of the liver, and in case of hematobium, as you can see, there is, because of the repeated inflammation of the bladder has now become calcified. Now this schistosoma hematobium, because of the repeated inflammation, it may also lead to malignancy of the urinary bladder. Next is Paragonemus. Now this is the trematode which infects the lungs. It has got a similar life cycle, but over here, after entering into the bloodstream, it will go into the pulmonary bed and from gut it will penetrate into the peritoneum, and through the diaphragm it will enter into the lungs, causing and will form cyst in the lungs. The eggs are laid within the lungs, which are then again swallowed and comes out in the fecal matter. Repeated infection of the lung may cause lung disease, granulomatous disease with expectoration of cough and radiological features like this. This feature may also mimic that of pulmonary tuberculosis. However, this is caused by a trematode called paragonus. The last is a nematode which also infects the hepatobiliary system. Previously, all are trematodes. This is caused by Capillaria philippinensis. It's a nematode, and this is acquired. This organism is found in rats. So, especially in areas where human beings come in contact with the fecal matter of the rat, they can be exposed with the eggs of this Capillaria philippinensis. They enter into the gut and then slowly move into the liver, where the adult worm will give the eggs, and also the adult worm can be seen. Hepatitis, cholangitis, and chronic hepatitis can also be seen with raised liver enzymes can be seen with this disease. So, in a nutshell, these are all about the tissue and intestinal nematodes.